Hi, I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic, and today's video is about treatment recommendations for carpal tunnel syndrome. Carpal tunnel syndrome is the most common cause of pain, loss of work, and work-related disability in the United States. It affects approximately 50 people per 1,000 people in the general population, and it's estimated to cost about $30,000 per injured worker who gets carpal tunnel in the workplace. Now, who's at risk for carpal tunnel syndrome is an important question we need to ask. People who are obese or have diabetes are at high risk. If you're over the age of 50 years old, you're also a high risk. If you have a strong family history of carpal tunnel syndrome, if you have hypothyroidism, autoimmune disease, or rheumatologic disorder, that can also be an issue. Highly repetitive jobs, like when you're using your mouse at your desk and just going back and forth like that, can be an issue. Substance abuse can even actually be one of the causes for risk factor for carpal tunnel syndrome. Now, what is the actual treatment for carpal tunnel syndrome? The whole point of this video. Wearing a brace that has like a splint in it at night when you're sleeping can really help with carpal tunnel syndrome symptoms. What happens is when you sleep, your wrist can curl or move around, going out of a neutral position, which causes extra pressure into the wrist and the nerves in that area. Carpal tunnel is really just a little sheath of tissue that protects the nerves that go into your hand. So you have this splint brace in place to prevent the motions that can agitate carpal tunnel syndrome and the carpal tunnel. The other thing you can do is exercise, like the stretches that I have posted in my carpal tunnel playlist on YouTube. Also, the nerve flossing is really helpful for people who have carpal tunnel syndrome. If you're overweight, one of those risk factors, you can lose weight, get exercising and eating a little bit better. The treatment success, though, the big part of this is like, it's all dependent on the diagnosis accuracy. There's people who get surgery on their wrist because they have carpal tunnel syndrome, and then after surgery they realize that they still have the same exact problem that they had before they got the surgery, because the nerve that's impinged that goes into the hand is actually impinged in the elbow or even the neck. So it's very important you get the proper diagnosis before you pursue a treatment with carpal tunnel syndrome. Now, what does a chiropractor do? A chiropractor is going to look at all of the parts that could be associated with the carpal tunnel. We'll look at the neck, we'll look at the shoulder, elbow, wrist, and even the hand. What we do is we do provide chiropractic adjustments. You can actually adjust wrists, elbows, and shoulders along with the neck and mid-back to really kind of get a comprehensive approach in dealing with the carpal tunnel syndrome issues. The other thing that we do is we're the least invasive for any type of procedure that we can offer. So it's the least amount of risk that you take when you get treated by a chiropractor. If you can get everything resolved with zero risk, why not give it a shot instead of jumping right into surgery is the way I look at it. There's muscle work associated as well with chiropractic. You can get some ART or some grafting into an area that maybe just has tight muscles that are just impinging on the nerves itself. And we can also address your ergonomic issues that you have at your desk. So that's it for me. I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. Thank you so much for watching.